There we go. Can you hear me now? I presume. All right. Well, I'm delighted to see you all and have the opportunity to have you enjoy this wonderful presentation that I know is going to be wonderful because I know these people. Molly's always a blast, so you can count on it. And I just want to emphasize that if you have the opportunity to please become members if you aren't already, or encourage your friends to become members. These brown bag lunches are free, but the class prices are de minimis. I mean, it's $35 for a whole year's worth. And therefore, even though these are open to the public, the brown bag lunches, without becoming a member, when we comment that we need to reach 1,000 members again, which we used to have over 1,000 for years in a row, that's what the Osher Lifelong Learning Institute is requesting of us to try to get back up to speed, because about 40% of almost all the OLLI programs, there are about 125 of them, lost membership. Ours was about 40% due to having shut down our classes in person and switching over to Zooming. So we're trying to build it back up, and if you can give a friend of yours a membership fee if they can't afford it, or tell them, you invite them in, haul them in with you, show them the catalog, show them how to get to the catalog. We really do. They gave us 3 years to get back up to 1,000 members, and we were at 946, I think, last year. So we got really close, but we need to get over the hump. So anything you can do. We won't be having a winter session this year. We're going to focus on the spring session after this one. You can still sign up, obviously, for classes. Now you can go online and do that. You can call OLLI to sign up, and they'll take it over the phone. The three day requirement got me because the class I was interested in was on a Wednesday, and I had to have signed up on Friday because they count. It was on Thursday. They count business days, so that meant I had to sign up by Monday in order to get in the Thursday class. And I was kind of kicking my own rear end for not figuring that out and not doing it earlier. So if you're really interested, and we're now listing our classes several places, including in the North Coast Journal, and that's free. So if you want to see the upcoming ones in print, you can pick up the North Coast Journal and it will tell you what's coming. Anyway, last but not least, in fact, the most important part of all this is to get to the introduction of our speakers. We have 3 of them here. Reverend Molly Cate is a humanitarian educator passionate about history, science, and bridging the barriers between people holding clashing belief systems. She's the spiritual leader and often soloist for Unity of the Redwoods in Eureka, California. She has a master's degree in consciousness studies from Holmes Institute in Santa Rosa, one in sociology from the University of California, Davis, and several certificates in cross-cultural competence. And she just let me know that she's now become president of the Access Humboldt board.
2 days from now, not yet.
Oh, well, you're anticipating.
That's if they don't say no.
Somehow I don't think they'll say no. And joining Molly are Laura Montanga and Debbie Hartridge, League of Women Voter members on the League's Behavioral Health Services Study Committee, and that's what we're going to be talking about today. Thank you so much.
Thank you, Jane and Marina. And 2 things I want to add about the OLLI program. I have a couple of friends who have never wanted to do Zoom classes, but when I said, well, why don't you just keep your membership going? They said, I can do that? Yes. Even if Zoom classes don't suit you, please do keep your membership alive. And the other thing is that almost making it to 1,000, that number drops to 0 every year from the Osher Lifelong Learning Institute people, and they have to start from scratch every July 1st. So we are in OLLI rebuilding to 1,000 now, and hopefully that will happen this year. But I wanted to add those two things. And also, of course, my great thanks to the OLLI program in general, the brown bag piece of that, which is where we are today. This is a great forum for so many ways of finding out what's going on in here in our county. And thanks to the Friends of OLLI in particular, who are the ones who fund these brown bag presentations. I'm so grateful that they are doing the work they do. And so a little more introduction of my two co-conspirators here. Laura Montagna is a filmmaker, and you may know her from her beautiful work, Addicts Among Us, that Cate showed and did some programming around. It's a very beautiful thing and very important part of our opening up to the very different ways that people suffer here in our county and how they are moving forward, and we're all human beings together. So she's also serving on the behavioral health board now, and Laura will tell you about the other piece that I asked her to talk about today, her work with the mobile team in Eureka in particular. So thank you, Laura, for being here today. And Debbie Hartridge, many of you may know, longtime member of NAMI, the National Alliance on Mental Illness, also a member of, both of these women are members of the League of Women Voters of Humboldt County as well, and also on the Behavioral Health Board. So they are here to not just help me, but to do the groundwork of bringing this alive for you in many ways. I am program director for the League of Women Voters of Humboldt County, and as such, I was asked to lead this study of behavioral health services in the county. But I am not someone who has had personal trauma from these issues in my life up close and personal. And so to have, I'll be the brain, and these two are brain and heart both. So the three of us together are going to present some wonderful things for you. So I'm going to start by giving you a little sketch of the League itself, and then I'm going to zero in on showing you the summary of the new behavioral health services position, because there's language in there I want to make sure I unpack for you there. And then after I finish with that summary, I will drop screen sharing at that point and come back to piece by piece going through the whole. Hopefully we'll go through the entire 7-point position, and that's where my colleagues here will really be able to pitch in greatly. So first, a few things about the League for those of you who may not understand it, or if you just like a little more language for trying to explain it to other people in your life. The League of Women Voters was established in 1920 at the point where women were finally securing the vote for most women in this country. It didn't secure the vote for all women at that time, but it made a good start in that direction. And this is one of the things that came out of that. And at this point, there are leagues at the national, state, and local levels throughout the United States and beyond. So I wanted to read you our mission statement first. The League of Women Voters, a nonpartisan political organization, encourages informed and active participation in government, works to increase understanding of major public policy issues, and influences public policy through education and advocacy. Now, that word nonpartisan, some people get stuck on that. It simply means we never endorse or oppose any political party or candidate. That's what it means to be partisan, is you have a party that you support or a particular candidate that you support. We do not do that. We look at issues, and the way we do that is through our studies. So the centerpiece of the League, of course, remains the expansion of participation in the political process to give a voice to all Americans. That is what the League is all about. There are more than 800 state and local leagues. They're in all 50 states, as well as the District of Columbia, the Virgin Islands, and Hong Kong. Everything every league does is consensus driven. Nothing is done without consensus. Education and advocacy are both strictly based on studies that have been performed by a state or local or the National League. And we can draw from all of those. So it's important for us to recognize that this organization, because of its rigorous requirement of studying a topic as exhaustively as possible, and then coming to consensus from different points of view of people, members of the league doing that study, this is about as close as you can get to honoring the truth. And I wanted to say that up front. This is really one of the things that people count on with the league, is that if we're giving out information, it's as close to being completely accurate as humanly possible. That is what we're trying to do always. So to get to this topic of behavioral health services here in the county, the first thing I want to say about that is behavioral health conditions are treatable. If you get nothing else out of today, please understand, as so few people do, that there's been enormous strides in neurology and biochemistry, and it's very rare now to have any kind of condition that is not treatable medically. The medicine isn't the issue anymore. The issue is access quite often, and we're going to talk about that today. The other main thing I wanted to say is I'm seeing a few things coming in now. It's lovely to have some questions in the chat, and thank you for doing that. If you would just pile up questions in the chat, or simply put into the chat the words "I have a question," then when between looking at sections of the position, I will stop the screen sharing or just ask Jane to start reading questions. So your questions hopefully will be answered. Let me get this beginning part out of the way first, if I may. It's a particularly fraught time of the year to talk about behavioral health matters, because around Halloween, we hear a lot more languaging that literally demonizes mental illness, literally demonizes it. So one of the things you can do to educate yourself is to pay a little more attention year round to the kind of words people use. Oh, that's madness to do that, or you must be crazy. This is the kind of language I'm hoping ultimately we can get rid of in our society, because it does not serve anyone, and it does great harm to some of our most vulnerable members of our community. So stopping the stigma is an important factor in what we wanted to do with this study. And we've had some marvelous things happen since the study was underway. It took almost 2 years to do. And today we get to talk about some of the great successes coming forward in the county as well. So thank you very much for being here. I'm going to share my screen now and pull up the document itself that has the actual wording of it. Can you all see my screen? I can't see any of you, so if someone would say that out loud,
We
that
can
would be
see it.
helpful.
Yes, we can. Can you put it on
Great,
share
thank you.
screen? Can you put it on share screen so we can see the document in larger form?
Right. I'll make it maximized for you, but basically I'm just going to be reading bits of it. The title is at the top. It's a part of our social policy set of studies that we have done. This league in Humboldt County has done 19 studies with this one included. And so this is our most recent one. It is called Behavioral Health Services. And of course, we are focusing on the county itself. And I'm just going to spend a couple of minutes focusing on this position summary at the top, where you see certain words are highlighted, bolded, and then those are the ones I have written here down below that I'm going to say a little bit more about. So the summary of the 7-point position reads: support of measures to provide efficient, evidence-based, culturally knowledgeable, and trauma-informed, I'll just define that later, even though it's part of the summary, publicly administered behavioral health care for all people in Humboldt County. So what do we mean by evidence-based? That is one of the most important things we started looking at, and several members of our committee, which came both from the league and from outside the league, really wanted to make sure that we focused strongly on the idea of evidence-based. There's a good definition of that has come from the National Alliance on Mental Illness, which says therapies that have been studied academically or clinically, proved successful, and replicated by more than one investigator or review. That's an important thing because for many years, for over 100 years, in psychology and psychiatry, all of it was more of an art than a science, and people would do what they theoretically thought was right. And more evidence-based practices bring us home, if you will, to the facts of what actually can help people. And so it's a very important concept, and it's very heartening to see more and more folks at all levels of dealing with behavioral health focusing on being strongly evidence-based. Culturally knowledgeable takes a lot of different forms. Being aware of the specific needs of a person who you're trying to help is absolutely essential. For example, St. Joseph's Hospital provides psychotherapy in Spanish. So if they didn't provide that, they would not be able to help people in this county who are only comfortable speaking their native language and it's other than English. And then, of course, there's the incredible help that an organization like Two Feathers Family Services is in educating all of the rest of us on the cultural specificity and knowledge of Indigenous people here in our county. And there are lots of ways to look at that. One of my favorite examples was I took part in a Zoom presentation co-sponsored by Two Feathers and Stanford University in 2021 on youth wellness. And one of the speakers there said, Maslow's hierarchy of needs that goes from being a member of a group to individuation at the top is upside down for Indigenous people. You start out an individual and you work toward becoming a community member. And that has stuck with me ever since. It's one of the most brilliant things I ever heard about understanding my Indigenous neighbors. So things like that. And then, of course, within Indigenous communities too, they have been working, particularly in the last 20 years or so, in finding ways to honor their own, what the rest of us call LGBTQ folks. And it's quite often called Two-Spirit people within Indigenous communities. It's not 100% accepted among people, but it is widely accepted in both Canada and the United States. And Two-Spirit people is a term that's useful because that is authentically original. Most of our Indigenous neighbors did not come originally into a society that was negative toward people we would call LGBTQ or queer. Those words were not in use for them, but they were not negative toward this. In fact, some of their societies held special honor places for such people. And Two-Spirit kind of covers that, not this or that, but both. And so that's another example of cultural specificity of knowledge. And that, of course, figures into as well the mainstream folks who do find themselves comfortable being called lesbian, gay, bisexual, transgender, whatever particular term for them. These folks too have their own cultural specific needs, and all of those and others too, in any different place, you're going to find different cultures represented, needs to be a part of this kind of process in order to serve everyone in the county. And then trauma-informed, perhaps the most recent of these terms, care that considers the pervasive and causative nature of trauma. And trauma is a huge factor here in Humboldt County. There's the main focus for many years called ACEs, Adverse Childhood Experiences, which many of you may know about. Anyone who scores 4 or more ACEs is at great risk of a number of factors, both physical illness and behavioral illnesses. And so our county has a huge number, larger than most of the state, of folks with 4 or more ACEs. And so that means that our care needs to be trauma informed. In fact, it should be everywhere. So in our community health assessment that the public health department did in 2018, it mentioned the lack of trauma focused treatment, such as ACEs, and considering also post-traumatic stress disorder and the after effects of sexual assault. These things need to be part of what informs what we're doing in terms of behavioral health care. And to their credit, St. Joseph's Hospital partnered with a number of different organizations to create Humboldt County ACEs Coalition. They're working on this now. And then the one more thing I would say at the beginning here in this introduction is that we are only looking at publicly administered care, publicly administered health, because the league does not investigate private companies, private businesses. It is out of our purview. We are looking at the public realm. And so that's what this study was looking at. We have a couple of folks in the chat. Jane, you want to read these for me, or shall I take a look here? Define behavioral health. Oh, Jane, that's a big one. Actually a good one to start with, because that was one of the first things that our committee took on. Some of us had noticed the language shifting in the field from talking about mental health to behavioral health. And it's a language change that has swept through the nation. And for many people, it's understood that it's sort of attempting to reduce the stigma around the term mental illness or mental health. There really isn't a good term for this, because so many of these are emotional. So many of them are in the brain, so they're neurological. It's a whole range of different things put in one basket. And so it's hard to find one single term that covers that. But in our committee, the first thing we did was to vote that we would use the term behavioral health. I see you've unmuted yourself, Debbie. Did you have something you wanted to say about this?
Is that okay, Molly?
Oh, yeah, that's why I asked you.
I mean, I think there are a couple things also that have to related to the term behavioral health, and one is just the definition of mental illness too, and behavioral health conditions are conditions that can disrupt a person's thinking, feeling, mood, and ability to relate to others. Their brain disorders, why diabetes is a medical disorder, they're no one's fault. And behavioral health includes what we would call mental health or mental illness issues, as well as substance use disorder issues. So that's part of it, is to make a bigger umbrella, because they're very closely related. And the term substance use disorder is now the commonly used term, at least in medical circles, instead of drug addiction.
Right.
So, and it's kind of an interesting topic to me in a way, because as a member of NAMI, Humboldt National Alliance on Mental Illness, we have chosen to keep the term mental illness. That is, the national organization has chosen to keep that. And I think it's probably for clarity. People understand what it means. So that's my input.
Now you can see why I invited these two here. You'll see from Laura soon enough, you'll hear from her, but that's exactly why I invited both Debbie and Laura to be here today. Thank you so much.
And Molly,
Yes,
just
Jen.
to clarify, really it's a change in focus. It's not just limited to your mental health, it's limited to your behavior that is caused possibly by mental health. It could be caused by drugs, could be caused by any number of things, ACEs, whatever have you. So it's really an increasingly broad scope of investigation and inquiry to
Yes.
understand the problems that are in society today. Anyway,
Yes.
that's why I wanted to clarify that.
Thank you. I see that the other thing in the chat is more of a facetious comment than something that requires me to reply to, but consensus building is indeed such an important thing to know how to do. I'm with you, Julie, on that idea that it would be good if everyone in Congress could learn or relearn how to build consensus. There is someone in the waiting room. Shall I? I'll just do that, I guess. Why not? Here I am. Great. So now in this next section we're going to start looking at the different sections of the full position. And here is where I'm definitely inviting both Debbie and Laura to chime in. This first section is about funding primarily. So I'm going to go back to that document and share it again so that you can see the actual wording of it. Let's see here. Where did my document go? There you are. It was hiding. So underneath the things I just talked about, we begin with the positions. The first one, and I've again highlighted some words bold or big so that you can see the focus of these things. This position 1 is on greater funding in lots of ways. About more beds for inpatient treatment, about improvements in current facilities, and more crisis care options for those with severe mental health challenges. That's usually in the lingo of the medical establishment, SMI, for severe mental illness. So that's one. And then also more funding for mobile response teams all around the county that will follow the lead of this beautiful CSET team in Eureka. And I know Laura will have more to say about that. And then to support a community safety net, particularly for the most severely mentally ill members of our community. So I wanted to invite Debbie and Laura to speak to these topics of greater funding for these services. And I'll stop sharing my screen at this point. Who would like to go first? Laura, stop screen sharing. Go for it.
So I guess I'll just, if it's okay now, to just do a brief overview of what the community safety engagement team is. And so I'll share my screen.
Good, Laura. Thank you.
So my name is Laura Montagna. I work for the Community Safety Engagement Team, which is a specialty unit with Eureka Police Department. And I was introduced to them when I started work on my documentary, Addicts Among Us, which deals with childhood trauma and addiction in Humboldt County. And as I got to learn more about them and see the work they were doing, I thought, this is amazing. This is kind of ahead of the curve in our state. And I was very proud. And I worked with them for quite some time as a volunteer, and then they hired me. I just worked part-time. But the goal is, you look at these photos of Eureka, and that's how we want our town to look. But CSET, which is short for Community Safety Engagement Team, our job is to deal mainly with the parts of the city that look like this. Homelessness, mental illness, drug addiction, substance use disorder. And so the CSET team was developed as a response to the issues that are mental health related, people in crisis, helping other agencies. And that looks like oftentimes our group is called to deal with people who are having a mental health crisis, but either the hospital is full, Sempervirens is full, there's nowhere for someone to go. And so we do a lot of diverting, going to meet with people, trying to find out, if, what are your needs? Oh, you haven't eaten in 3 days and you're just breaking down. What can we do to help you? Where can we get you, your needs taken care of? And so these are the things we help with a lot. One of my jobs as a homeless liaison is to develop a relationship with someone and then find out, how did you come to be here? Are you, from Humboldt County? Are you from somewhere else? You got stuck here. You want to go back home. One of the best stories was there was someone who was constantly getting calls from the police department, because he was very industrious. He would walk around town and he had big knives that he'd strap onto his legs, and he liked to build things out in the brush, and just he was always very respectful and pleasant, but he got into trouble and he scared people sometimes. And so after developing a relationship, found out that he wasn't from here. His family was back east. And I reached out to the family, was able to develop a relationship with them, and said he wants to come home. And so we worked on that, and they were very fearful, but a lot of things got put into place. And so he got back home, had to take a bus with 7 stops, made it. And his mom reached out later and said, "This is the first Christmas we've had together as a family in 22 years. Thank you so much." And it's different than just putting somebody on a bus and saying, "Go home." It's developing the relationship, looking for the resources that will help both the family and the person. And so those are the kinds of things that I love doing in this job. And that's one of the things that CSET does. So again, our functions are working with homelessness, mental illness, substance use disorder. And the way that we do that is responding, creating relationships so that we can have proactive engagement, and then working on special projects. So 80% of what we do is relationship building, outreach, addressing the behavior, and then knowing upstream de-escalation is like when you have a relationship with someone, the things that are going to kind of key them off in a negative behavior. And so being able to work with people, knowing maybe an area that they are, and that if something has happened, someone has passed away in their life and they've lost a pet, knowing this person's going to be stressing, there's going to be something that comes up. Let's go find them. Let's reach out and see how we can support them to get through that in the least negative way, I guess I would say, possible. Some of the special projects that we do are problematic encampments. Every 2 years, we do a homeless survey that's different than the point in time count. We actually spend a month, and we have it's on our phone, an app that we ask questions. And sometimes people don't want to answer the questions, but we ask, do you think you have mental illness? Do you have substance use disorder? And because we have relationships with people, they're mostly honest. And so it's very good data. And the commander, LaFrance, who's started this team, loves data. And I think that's really served us well, because we can track when things are working, when they aren't, and then change things. We do a yearly service fair in conjunction with Free Meal, which is run by St. Vincent de Paul. That brings all the community partners together. We have people down there that are there. If you haven't been to Free Meal, anyone should go volunteer, go eat. It's a wonderful place that St. Vincent de Paul does for our community. Creating partnerships is one of the key things. It's one of the key things I do. Knowing who to contact when someone needs help, and relationships are so important with everyone. So I think that's one of the reasons CSET has been so successful, is that we have relationships with community partners. And one of our mental health officers, very well known, Officer Swanson, used to go to the ER and bring everyone Starbucks, every couple of months. And that's such a simple thing, right? But they just love him, and they're like, "Oh, we will help you." That's just one instance. Warming centers is something that, it's so interesting. When it was really cold last year, the year before, people are like, where we should be doing something. People are dying. And we saw several deaths of people, unhoused people who died. Again, Eureka Police Department was like, let's just do something. So we came up with these very quickly, within a matter of weeks. There was a church that said, you can bring people here, and they set it up. And then we would actually drive around on really cold nights, pick people up and take them to the warming center. And then they would get a ride back into town the next day. Those kinds of things where it's that thinking out of the box and just, here's a problem, let's solve it. How quickly can we do it? AOT, which is Laura's Law, is assisted outpatient treatment. And this was something our county in the beginning did not want to do, didn't think that there were enough people to serve. And that program has been going, it was a year in July. And this first year they took 10 people, and Eureka PD gave a lot of names of people like, we think this person would benefit greatly from this. And it's actually been going very well. And we're really supporting that these people get specific care. It's for people who have escalating violent behavior with mental health disorders, and then trying to keep them out of the system and get them intense. What are the services that you need? And if it includes, we don't do this, but the team that's helping the people will go out daily and give people their medication. And again, it's about relationships. COVID-19, it's old news. It made a lot of issues, but I also feel like we learned how to pivot quickly. And this three-pronged approach, I just wanted to show that the development, CSET was first 2018. It's developed, and they worked with Uplift Eureka to, they have outreach and support services. So there's a couple of guys there, Robert and Larry, who have lived experience. We work with, when somebody's in distress, we can contact each other. Hey, help us out. And then just most recently, the mental health team of Eureka Care, Crisis Alternative Response, they had funding. They go out in their vans when there's a mental health issue that police decides this isn't dangerous. This person is just needs some help. They need somebody to talk to them, help them get their meds, help them show up for counseling. That team is developed. So this whole attitude of how we can help and serve the community has been growing, and I'm super proud to be a part of it. And I think it's very effective. Our team consists of a sergeant. Right now we have Sergeant Omi. He's a pretty fun guy. We have a missed officer, Officer Clark. There's supposed to be 2 waterfront rangers. Right now we have 1, and also an Old Town officer, which isn't filled right now. There's a community service ranger. She's not a sworn officer, but she does go out along the waterfront trail. And then the community service officer, that's quote unquote, that's me. I have multiple titles, and you can tell I love my job. The CSET, we are trained. These are a lot of the things we've trained in: trauma-informed care, de-escalation. We've all done the 40-hour advanced CIT training, and we know how to get out and about and network with people. These are some of our guiding principles that we work really well in developing our community partners. We're fun. We cut the red tape. That's probably one of the biggest things that we can do. And I realize that being a police department, there are certain things that you can do that you can't do when you're not a police officer. But we do that with compassion and accountability, and it's a wonderful team. So some of our partners are the ER at St. Joe's, working with Uplift and the city on cleanups, and then Free Meal is Salvation Army. We do a lot of work with them. Connecting with people, kids, babies, that's Officer Clark. Her focus is a lot on children. They seem to just find her, and she does a really good job of working with CWS and getting kids into safe places. Compassion and accountability. That was one of the first things that Commander LaFrance talked about. He's like, we need to improve people's lives, but we also have to take care of the community. And so this was a note. Thank you again, Officer Clark and Officer LaFrance and Officer Swanson, for assistance in the betterment of my life. I wouldn't have gotten off the streets without them, and the rest of EPD. God bless all of them. And we do get, we see people all the time who maybe have a job now or something, like, man, I'm so glad you arrested me that time. I needed something to kick me in the butt and help me make a difference in my life. Cutting the red tape. That's just, we kind of work with waterfront or different substance use disorder facilities to get people in. That was Officer Swanson moved somebody, helped just, I'm going to borrow the truck and we're going to get you moved to your new place, and whatever we need to do, we do it. And this is another thing that Commander LaFrance says, we have to go upstream and address the underlying cause and correlation of crime and disorder, mental illness, substance use disorder, and trauma. And that is my presentation. So I will unshare if I can figure out how to do that.
There are a bunch of questions in chat.
All right, let me get that open. Should I?
Stop screen sharing is usually at the top middle-ish of your Zoom screen.
No, I
Top
need to
in the
get
middle of
that.
the top area of says stop sharing or something like that.
It went away. Oh my.
Not supposed to do that, right?
There we go. Did it stop?
Yep, you're good.
So there are indeed a few questions in the chat. Would you take them on, Laura?
Sure. What kind of reception do CSET members get from homeless members? Typically, are members paid or volunteer? Okay. The reception is, now people who have been out on the street know us. We have a different uniform. We wear brown pants instead of blue. And so oftentimes somebody will say, like, you know, hey, do you want to talk about what's going on? And they'll say no. And then somebody will holler, no, they're cool. They're the good ones. You know, you can talk to them. All she wants to do is help you. So I think we're well known now. And these are all paid positions. I mean, I did volunteer for a while, but then the chief said, you're here more than I am. You should get paid. CSET did have Measure Z funds. We did not get those last year. And so this is such a successful program. There's no way it's not going away. The new chief now, Todd Jarvis, is, you know, we're going to keep, this is the only specialty unit that's still going right now, even though we're down officers. It's successful, it works, so it will keep going. I don't know about the money, but the commander is a miracle worker. So I think in that one slide, I talked about what kind of training we get. There's a lot of training, trauma-informed, crisis intervention. The MIST program is, I always forget what it sounds.
Mobile something.
Yeah, that's as much as I.
Yeah, right. It's a county program.
Right, it's a county program. And so different entities, like Arcata Police Department has 2 MIST people. It has to be paid for by whatever agency has it. We call our mental health officer a MIST officer. And so we have an officer, so we don't need to contract with the county for MIST people. I think that each community gets to decide if they have funds and they want to work with that. And that's a county clinician who will sometimes ride with law enforcement. I believe the sheriff's office has 1 MIST person with them. Laura's Law is the law that came about when a clinician was killed by one of her clients. I guess his erratic behavior and violence started amping up, and they figure she was working with this person. She was killed, and so Laura's Law came out of that. And a lot of different states have it. They call it a different person's name sometimes. It's just when you can see somebody is escalating and you can look at their history, some major intervention has to happen so that they don't, do violent behavior and harm someone. And so that's what Laura's Law, AOT, or also AOT, assisted outpatient treatment, came in.
Can I throw in a couple things about that too?
Yeah.
Laura? Just because one of the reasons the League works so hard to develop positions is so that we can advocate for things. And Laura's Law is a California law. I forget when it was enacted, but it was not required that counties adopt this program. And Humboldt County was a bit behind in adopting it. In other words, the supervisors had decided not to adopt it. And it was just sort of being let slide. And then about 2 years ago, the state required the counties either adopt the law, implement the law, that is, or that they explain why they weren't going to do this. They had to make a decision, either yes or no. And so that's where the advocacy part came in for some of us, because of the type of law that requires people who are brought in and sort of cajoled, semi-coerced to do things. That is, if they some people don't like the idea of having any kind of legal requirements for people to follow through on their treatment. And so it wasn't without controversy in the state. And so, but locally, we did advocate, NAMI, that is the National Alliance on Mental Illness, advocated for implementation of Laura's Law here. And that involves, it's a small number of people that are worked with, about 10, maybe you said that already, Laura. So, and who are referred by, they can be referred by family members for that matter. And there's a way to do it online. And there's a whole program that works with them to kind of keep them getting their treatment. And it involves the courts if they're not following through. But it's kind of a voluntary program, but they have to follow through once they're in it. So the advocacy part, I think, is where I get interested in terms of knowing all these things that we know. What can we do to improve things, improve services? And that, to me, that was one thing that NAMI could do, is go to the Board of Supervisors and say, please do implement Laura's Law. So there you go.
Okay, last question, or can CSET provide training for community members interacting with homeless people or people in crisis? Yes, we do that. Commander LaFrance does a training. I'd say it's about every quarter. And Officer Clark and I have also gone to businesses where they've had, down in the Old Town area, how do we deal with people? So just reach out to the department and we can make something happen. We have a training next May that's already scheduled for the community. And how do you track success? Are you talking success for the program or success for individuals?
Both. Both.
Somebody said both.
I guess, we have statistics on people we've assisted, that how many diversions, how many people have gone into treatment. We have a lot of that data. Personally, how do you know you have a successful life?
Well, that's, I mean, how do you define success? I mean, what is success? Is success getting them off the street? Is it success getting them off drugs? Getting them into housing?
It can take a lot of forms, I would say.
Maybe
I
it's
would-
fewer arrests.
I would say that the same, if you feel like you're a success, if you feel like you're a fulfilled person, you're grateful for things in your life, then you feel like you're successful. We're all humans and we all have that same success thing. That's a good question to add to our survey that's coming up next year.
Yeah.
Yeah, because I think that would be invaluable information to give the Board of Supervisors.
Well, that's what I love about this.
Whoever
Jane.
your funders are, but
Debbie, by the way, you're not on screen. Your screen is on, but you're not in the picture.
I'm
Just
not?
wanted to let you know, in case
Oh,
you didn't
dear.
know.
No, I
Uh,
didn't. Where am I?
And
Where am I?
there is one other question
Where?
about new legislation requiring
Oh, I know.
involuntary treatment. And I'm going to just say pass because we want to focus on our position statement.
There's a whole lot more to cover. Yeah, I'm starting to see the time here. I just want to
Let's
say
see.
diversion is largely to divert people out of the criminal justice system. We still have a vast number of people, well, a large number of people who are getting all of their behavioral health care in the county correctional institution, and they're doing the best job they can with it, but that is not where it belongs. And that's one of the beautiful things about the CSET program. And I want to just give a little more of a nod to this program being groundbreaking. The whole country is paying attention to Eureka because this program is setting a new standard, first of all, for what it means to be a police officer in service to your community rather than shooting people on the street. And it's in service to the most vulnerable among us. So did I cover that pretty well, Laura?
You aced it. You're better at those words than I am, Molly. Thanks.
Thank you.
Good job, guys.
Thank you.
I can't figure out what I did. I must have hit the camera button somehow.
Well, your
Can you guys hear
camera's
me?
working fine. If you could just see the little green lit up button where it is and put your face in front of it, then you will be on
No.
camera.
Well, what it's done is it's turned the camera to the other side, you know.
Can you
I don't. You're on your phone. I don't know how to use the phone thing.
I'm
So
on my iPad, so
you might
anyway.
just turn your phone around and you'll be in the picture. At any rate,
Oh, I see
it
what
is,
you mean, but then I won't be able to see.
it is
you
relating
guys.
to.
Can
Am I
I
in?
Let me just go on while you're
interject,
doing
ladies?
it. Please, Evelyn. Yeah.
Thank you.
Go
I
ahead.
am actually, I'm a family nurse practitioner and I've worked at Semper Virens on and off for over 20 years. I currently go in and I do the physical exams when a person is admitted. And I worked on the psych emergency services at night for quite a while. So a lot of suicide prevention. I'm just wondering, how does one in the community access this information? I have a grandson who works up at Chase Bank and he's been harassed by several homeless folks there. And he's just kind of he's only 18, so he's kind of beside himself. What does he do? Who does he call? And how can he help? Myself working as Semper Virens, how can we get a hold of these resources? Are you going to have a listing of them possibly?
So I put my email into the chat.
You're talking about CSET? If you're talking about CSET, then you contact the Eureka Police Department. They're the ones who run this program. And anyone in another part of the whole U.S. actually could contact them to find out. And people are doing that from around the U.S. to find out how this program operates. We are not doing that. No, the league does programming and so forth, but we're not able to take individual questions of that kind. But I appreciate that many people have got them quite right.
Can I
But-
say something about that
Yeah.
too, Molly?
And NAMI, of course, you can always contact local
Well-
NAMI. They're going to be a great
Well,
help.
let's just, what I was going to say was National Alliance on Mental Illness, NAMI, of which I'm a longtime member, has participated and helped organize training programs for police and other first responders every year for the last, I don't know how long. So, so what we recommend to people is to call. You can, if somebody is harassing you or whoever, if you call the police, if you're in Eureka, the Eureka Police, Arcata, etc., Arcata Police, but ask for a officer who is trained in CIT, which is crisis intervention training, and that often, I mean, I can't guarantee 100% of the time that that's going to be successful, that you're going to get the right person. But if you do get the right person, which many of us NAMI members can attest to having done, that person will help diffuse the situation and will make things better for all around without calling the police and getting, you know, somebody thrown in jail necessarily. He'll de-escalate the situation. So the police can be a good resource in that regard, wherever you are. We've been part of the training for police, and other sheriffs get the same kind of training. So some fire people. So try them too. Laura, do you agree with that, Laura?
Yeah. Some departments are better trained than others.
Yeah, okay. But
It's
it's another idea.
The important thing in all of that, I so appreciate, as always, what the two of you are sharing. Debbie, that was awesome. Crisis intervention training. If you just say CIT, they'll know what you're asking for. That's the important phrase to remember to say, because you don't want to just have an officer deal with this. You want someone who's been trained to deal with this. And we've been the county, the DHHS in the county has been doing CIT training with the help of NAMI for a long time. So that was great advice. Thank you, Debbie. I see we're at 1 o'clock already, and we have a lot to cover yet. So I reluctantly have to say, Debbie, I don't think we can spend time doing a lot on the funding for more beds, but just to say that that's part of what we are advocating for. Is that okay if we kind of move on? Because
well, I guess we're making our way down the page, right, Molly? And you're gonna.
I am going to. Yeah,
I do. Let me just say, I think I'm really invested in the idea that what we do will lead to some advocacy work, and so I don't. Some of the changes in California law that are coming down the pike will bring funding for more beds if passed, and some of them have to do with their initiatives. There are going to be 2 initiatives from the state. So NAMI is probably going to be supporting both of those initiatives if they're not already, because we do see that funding to help the most seriously people in need is a crucial priority for us. So funding equals advocacy and support, because nothing changes without the people behind it. So that's my piece.
Beautifully said, as always. And there are great things happening in the county. There are more facilities opening up, and there's a training facility opening up. The county has been using perhaps COVID funds really effectively in some of the ways this is developing. So keep your eyes and ears open for media letting you know as these things come online, and to serve youth and to serve this greater population in so many ways. And these things were happening while we were studying this issue. It was very exciting to watch new avenues of funding and support come into the county, or particularly in Eureka. Eureka is a shining example of how you can actually produce a sense of being a neighbor to even the most troubled among us. It's a beautiful thing to behold, and I'm so grateful to live here in the northern part of the county where we get to experience this, and it's really lovely. The league has a national reputation, yes indeed, and Eureka now has one too that's really positive in how these things are unfolding. So about just back a little bit, Laura's Law is indeed connected to the new state program called Care Court, and I'll say a little bit more about that when we get to the 6th part of our position, which has to do specifically with what is most controversial about the Care Court program. But let's just move on so you can at least see the wording of all these different sections and get an idea of what this is meant to. It's just disappeared again. It's gone behind here, I think. Let me try to find you. Where did you go? Oh, you know, technology can be very bizarre, as I'm not the only one noticing that this morning. It is something that I had up just a moment ago, and now it seems to have gone away. Let me see if I can find it and bring it back up for you to see. The next part of the position. Here it is. It goes into hiding. Very strange, but there you go. That's probably hiding from Zoom. So we talked about the funding piece, and there are more things that could be done with funding, but these are the parts that we zeroed in on as a committee in doing our research of all kinds, online research, books, videos, actual interviews with people. And we zeroed in on these three because they seem to be the most impactful. The next part of the next section of this position talks about staffing. And of course, we're all aware that there's a vast need for more folks doing this work on all levels here in the county. And we zeroed in here on some specifics, hiring clinicians with the most up-to-date, medically sound, culturally sensitive training. And then seeking out is, of course, going back to funding, but it's talking about ways we can promote retention of behavioral health professionals. So we put it under staffing as a funding issue that has to do greatly with staffing improvement in the county. And then this was an important piece that came out, streamlining procedures, the way things are already being done, and helping with developing the availability of continuing education programs for our folks so they don't burn out and give up the field. One of our most wonderful contributors to so much of our committee, and he was never a member of the committee, but he's our mascot, if you will, is the wonderful Jacob Rosen, who right now is working with the city of Eureka and providing some of these town hall sessions. He's done 2 of them so far, and I believe there's a third. So he's doing great work in Eureka as well. And when he was interviewed by us, he said that many continuing education topics are required by state law for clinicians, and here in Humboldt County, they have to provide their own continuing ed. It is not covered by DHHS, and so his suggestion was to help with the overburdening of staff who have difficulty pulling away from their work to take continuing education courses, and to help them do that to reduce burnout, and that overall enrich our rural life in so many ways by having them more culturally sensitive in their training and having them more confident that they're up to date on the most recent parts of what they do. So it really, for Jacob, is primarily a anti-burnout tactic. If we can help streamline the procedures that folks have to go through to get some time for continuing education, and then help provide it for them where they don't have to pay for it themselves. And the fourth part of this second section of the position is to talk about coordination between Humboldt County Behavioral Health and local institutions of higher learning. And I'm so excited to talk to you briefly about this because of the way it developed. We had invited Jamie Jensen, who is professor of social work at Cal Poly Humboldt, and Brandy Lynn Villarreal from the psychology department to come and speak to us in one of our committee meetings one day. And after that, they wrote to us to thank us for jumpstarting a new conversation between them about their respective departments, and the realization they had come to that much more can be done to dismantle silos between them on campus. And also they're fully supporting dismantling silos between themselves and DHHS, Behavioral Services Branch, and other organizations in the county. So that conversation we had, we learned a great deal from them of what they had to teach about social work and from a psychological perspective. But they also learned a lot from participating, and it was a very exciting moment. So this is one of my favorite pieces, actually, of this whole position, is this coordination piece between behavioral health and many local institutions of higher learning and folks who can help with the training, hiring, and retention of all levels of healthcare staff in behavioral health. So the third piece here is focusing in again on the evidence-based piece. And you've heard it talked about by Laura in particular, of how the evidence they have gathered for the CSET team gives them confidence in knowing what parts of what they are doing are most effective, and therefore to zero in on those. It's also being used very effectively and importantly in what's called dual diagnosis these days. That's just a quickie term to talk about people primarily who have both a substance use disorder diagnosis and a behavioral health diagnosis. And we had to talk about that. Several people, dear Jacob Rosen, talked about that with us for a while, and also Dr. Ruby Bayan of Waterfront Recovery. And she pointed out that Waterfront is nearly unique in simultaneously treating both of those. It is not common to find clinicians who will treat a person's behavioral health concern while they are also categorized as having a substance use disorder. Something going on very special at Waterfront Recovery because of that. And it's the first and a unique model in Northern California, she told us. Jacob talked about having low staffing creates so many wait time issues for people who are trying to get both of these issues dealt with. And so we wanted to focus on that piece as well. And there's also here the focus on suicide prevention. It's a huge issue in Indigenous communities, among the youth. And of course, you've probably seen the numbers since COVID. Suicide is up, and it's very sad to behold. So suicide prevention, education, and treatment. And again, with the focus on the most vulnerable groups, that's also in this position. We also had number 4, supporting the idea of community-based education for behavioral health support in the general public. How do you encourage your legislators, for example, to provide new programming or support programming coming in from the state, such as the Care Court, which is what people were asking about before? It is related in a way to Laura's law because it asks for people to be carefully monitored in whether or not they're staying on their medications. And I'll again get to that in a moment because it's its own part of this position later on. But there's ways in which our county is doing this community-based educational approach already. St. Joseph's Hospital is very strong in this. They're doing a lot of work around that. And streamlining services was something that Jacob Rosen spoke of in particular, because it's so confusing for people to navigate between their physical health, their behavioral health, all the different clinicians they may need to see for this or that. It needs to be more streamlined so that it is not such a web work for them to navigate. So that's definitely been important. One of the things that we noticed from talking to Jacob in particular was that the system can really be so very frustrating for people if they can't wend their way through it. It creates barriers to care, and it creates discouragement to find care or to continue with care. So this is very important. It was also in our public health department community health assessment in 2018. They're now working on the next one, which isn't out yet. But this is a very important issue for them as well, to get rid of the barriers that discourage people over and over again, such as repetitive paperwork, difficulty in transportation to multiple locations to see health providers, and conflicting information that sometimes comes through these different sites. So it's important for people to be able to wend their way through the system. Now, I have seen not a whole lot's come into the chat, and there's a little more to share with you, but I wanted to just see if anyone had a question. We have just a little more time here, but I want to be mindful that your questions are very important here. So if you have anything you'd like to add, please do. Otherwise, I'll finish up what our position says. That we haven't got.
Rowetta asked, do you have a site where appointments can be made to speak to someone for guidance in dealing with a situation?
And the league does not do that, is what I said. No, we don't. That's not the league's work. So that would come through, as Laura said, talking to a CSET, a CIT officer. The league study, to find it, yes, you can go to the league's website. It is posted there. And let me give you a little bit of a navigation to it, because it's a little bit tricky. If you have ever been to our website, you'll know that the menu bar is down the left side of the page. And so if you find the word issues in there, click on that and the word positions will come up. And then when you click on that, you're into just scrolling through one position after another to see all 19. And that is how you find them at our website.
Molly, can I mention
Thank you
NAMI's
for
website too
being
while
here
we're
too.
at it?
Yes, Debbie. Sure.
Just jumping
Just
on
do
this.
it. Go.
NAMI Humboldt has support groups for family members that meet twice a week in Eureka. That's a really good place to go to get some ideas and about who to talk to or what to do about situations. So I do recommend going to one of those support groups, and you can find out about them by checking our website, which is nami-humboldt.org, namihumboldt.org. Support groups can be very helpful.
Yes, indeed. Thank you again, Debbie. So let's look at the last few sections of this position. Hopefully it's not gone away again. I'll try to get it to come up. It keeps showing me something else instead. Yeah, I don't know how to get it to come back, but it did on its own a moment ago. So let me try what I did before. It's just, I think because the Zoom is up, it's being very weird. And here we come. So the last sections of this, 5, 6, and 7, are more specific. Well, 5 isn't so much. Actually, it's very broad. What am I saying here? The community determinants of behavioral health difficulties are, like the community determinants of health overall, very important to the public health field, and where that term first became important to those of us serving on the committee. So these are things that go beyond the actual medicine involved in care for someone with behavioral health issues. And they are things that we all need as a community of neighbors to take on. And here I've highlighted some of them. The deficiency of supportive housing. If you go to our website to look at our positions, we have an extensive position on housing, and I recommend it to you. The understaffing of the system, we know that's pervasive all across the country, and there are some innovative ways of dealing with that, some of which have to do with these collaborations between College of the Redwoods, Cal Poly, and DHHS Behavioral Health, and for other organizations perhaps too. There's a lot more, I think, innovative thinking that can be done about this understaffing situation that we're still in the middle of figuring out. Then the third piece here, a community determinant that is very much being dealt with forcefully in Eureka with the CSET program, is to try to undo this prevalence of incarceration over treatment, which is a national issue, because of course there have been huge changes in our system of behavioral health care over the decades, ever since in the 80s, when the state hospitals were closed all across the country, which of course escalated the homeless situation. Unhoused population of people were originally, many of them who had just been tossed out of mental health care in an institution. Whether that was poor care or not, they were at least not on the street. Now, what people are calling for now, in particular, the wonderful Dr. Tom Insel, who was the director of the National Institute of Mental Health for many, many years. He's now going around speaking about ways to really have a good system. His book is recently called Healing: Our Path from Mental Illness to Mental Health. And he has pointed out that it is absolutely crucial that we keep in mind that the incarceration of people is not the way to provide this kind of care. And that came about through the system failure that I just mentioned. So he's a strong advocate in trying to move forward in making this a go forward for people to get the kind of help they need at the community level. And this is a strong part of the position for that reason. These last two kind of go hand in hand. There's this fancy word here you may not know how to pronounce. I learned how to pronounce it by serving on this committee, is anosognosia, and it means the inability to consistently recognize one's illness and the need for continuing treatment. This is considered a diagnosable characteristic of some of the most serious mental illnesses or behavioral health issues out there. And it is a real thing. Anosognosia, really, I've actually talked to a person who's absolutely convinced he doesn't need any care of this kind. He doesn't need to take his medication until he's on his medication. And then he says, what am I thinking? Of course I need to take this medication. Then he stops and the cycle repeats over and over again, and he goes back to the county jail, and it's a cycle of despair is what it is. So anosognosia comes up strongly now because of the care court program that the state of California has been promoting and putting in place, and it contains a provision that Debbie mentioned earlier. It's controversial about whether care should be provided for people against their will. And my favorite way of looking at that comes directly from Dr. Tom Insel's talking about it in a talk I found online that he did at University of San Francisco Medical Center. And he said, there's no way that we would allow our elders with severe dementia just to wander out in the streets and live in public parks and be unhoused. We instead care for them. And this is the way we should be treating those with mental illness so severe that they do not consistently recognize they are ill. It is a compassion issue for him and for those who are in favor of the care court. We talked about it quite a bit and came to that same conclusion. And so because it is a poorly understood indicator of severe mental disability, it needs to be taught more at all levels of training for health providers. And of course, it needs to be understood more by the general public. The last section in here is to support law enforcement personnel, all of them at all levels of law enforcement in the county, to have at least 16 hours of education devoted exclusively to behavioral health topics. Right now, it's half that amount of time, and it's put in together with other things besides behavioral health information. So we're advocating for a real increase for folks so that our officers on the street are not so likely to be afraid of interacting with someone. There's a great stigma that people who have some kind of behavioral health condition are dangerous. They are actually less dangerous statistically than the general public, though they deal with more police use of force than our African American population does. This is a statistic from Dr. Insel's book. The police use of force nationally is 4% of our African American population and 10% of those who have severe mental illnesses. And then there's double jeopardy if a person is both. So this is a very dangerous area. And many of the people you read about in those horrible stories of someone being shot by the police are actually suffering from some behavioral health condition. And they are, of course, often people of color as well. So the combination is pretty lethal. So that's why we're calling for a much greater training of all our police officers. We have just about 7 minutes left, so I'm going to open it to my two co-presenters for anything I've missed or misstated and anything that you want to share as a part of the audience.
Molly, can I have a shameless promotion that won't take long.
Promotion. Good.
Shameless
Yes, please. I was
promotion.
hoping you'd get to that.
just NAMI, I'll tell you about NAMI a little bit. We're a national organization. Locally, we've been in existence since the late 70s, and we were, one of the founders was an Arcata woman, who some of you might know, one of the founders of the national organization, Sarah Turner, who's passed away. But we are all volunteers, and we would love to have more volunteers. So if you might be interested, check our website. Most of the people that I know that volunteer for NAMI have family members with serious mental illness, including me, which I have been dealing with, which our family has been dealing with since, well, for 20 some years. And so we know, we've learned a lot, and it's a very challenging, painful kind of aspect to life in many ways. But what I wanted to put a plug for was NAMI Humboldt is presenting, we're calling it a multicultural symposium, and it is going to be November 4th in Eureka at the Warfinger building. There are going to be some interesting speakers that address some of the topics we're talking about here, including the chief of the Yurok Tribal Police, the chief of Rio Del Police, Betty Chin, who works, as you all know, with homeless folk. There's the director of United Indian Health Services should be there, and a counselor from HUPA, Tribal Health. Let's see who else is going to be there. Some very kind, and I think Jacob Rosen is going to be there. Am I right?
Yes. The managing mental health clinician for care.
Yeah, Jacob Rosen, who Laura works somewhat closely with.
What an amazing
Anyway,
guy.
it's a lot of speakers and a chance to learn and get some resources. And so check our website again, and it's nami-humboldt.org. And that's my pitch about that, Molly.
Thank you. I see that Laura put the direct link to the particular position we're talking about today, and I tried that the other day and it did not work. So I've underneath it put the general link to the league here in Humboldt County, in case you can't get in by the one that Laura posted. It should work, but it does. You know, these things don't always work the way they should. So you've got two options to get in there and get a look at the whole thing yourself. And Julie's got her hand up.
I'll explain this in 30 seconds, but contact me if you're interested. It ties to Debbie's comments. I'm working with Betty Chin to find 33 people who will commit to $200 a month to support a home for someone she will pick up off the street, get them into good housing, help them get all of the paperwork they need and the healthcare and mental health care so that they can eventually have a real apartment. $200 a month. It's like the price of a couple of dinners, and hopefully many people can afford this. I have about 24 people to go. So contact me if you're interested.
That's a great way to do it, Julie. That's wonderful. So I hope you're working with NAMI and they know about this. That's certainly, I think, what do you say, Debbie? That'd be the way to go forward with it. Yeah, I think it'd be wonderful for NAMI to be involved in that for sure.
Good to see
I'm actually trying to find people who maybe aren't paying that much attention, but when they go out to eat and realize how much they're spending, that they could like help someone they just walked by on the street to stay in a home for the same price that they spent at Brick and Fire or Plaza Grill or wherever. Really, seriously, it's not that much money for most of us.
Are there any more questions? Comments? Otherwise, we have multiple thank yous for this valuable presentation, and I want to thank the speakers and all the work you're doing on behalf of the community. I think it's fantastic, and I appreciate your sharing it with us. And I want to, in the concept of promotion, by the way, I'm giving a OLLI class on sleep on November 4th. If you'd like to come, you need to sign up. That's on a Saturday, so you need to sign up by Tuesday. but just wanted to let you know. And then next week on October 30th, we're going to be having a talk on Montessori, not just for children, but changing old lives as well, by Ann Kelly. Traditional aged care may create excess disability and can rob people of the independence and dignity of their independence and dignity. Montessori enables people to be the best they can be by supporting memory loss and independence. Learn about the application of Montessori principles to aged care. That should be very interesting.
What a wonderful thing. Wow. I
Yeah,
look
so
forward to
we'll
that
look
one.
forward. I think she's somewhere in Europe, so we're going to have to, poor woman's going to have to come at some bizarre hour of her world, but she's planning to be here. So
What I love
I look
about that
forward to
is
seeing you all.
it's a way in which it's opening up a new way of looking at an old program.
Oh yeah, and very innovative way with this application. So we're learning.
Thank you so much for everything at this program. Is great.
And by the way,
thank
if
you for being
anybody
here.
has any suggestions for topics they'd like to have for the brown bag lunches for the spring, feel free to get in touch with OLLI or with me directly at janepwoodward@aol.com. I'm delighted, and you can go and submit a proposal. If you go to humboldt.edu/OLLI, you'll find a proposal form for the brown bag lunches. So we love to hear from you with ideas just like Molly did with this, which is wonderful.
Thanks so much for being here, everybody.
Thank you.
Thank you.
See you at
Have a
other
great-
brown bags.
Have a great week. We're losing the 60s. It's moving into the 50s.
Thank you, Debbie. Thank you, Laura. Bye.
Bye-bye.